In this ASH 2019 meeting here in Orlando, we will be presenting on behalf of the Acute Leukemia Working Party of EBMT a very important study comparing the use of ATG versus post-cyclophosphamide in patients who are transplanted using a matched sibling donor. As we all know, post-cyclophosphamide is really a popular GvHD prophylactic approach in the haplo-identical setting. However, given its efficacy, many groups are now trying to use it with other type of donors, namely unrelated donors, but also HLA-identical sibling donors. Unfortunately, we do not have yet the final results of any randomized trial. This is why we had to rely on the registry of the Acute Leukemia Working Party, focusing on AML, and we were able actually to compare two groups of patients who received post-Cy plus sometimes other immunosuppressive therapies, and another group of patients who received immunosuppressive therapy plus ATG for GvHD prophylaxis. And the key findings from this retrospective comparison was that we can achieve same results in terms of leukemia-free survival, in terms of incidence of acute GvHD, non-relapse mortality, incidence of relapse. The only difference we could find is about the incidence of overall chronic GvHD, but also extensive chronic GvHD, which is higher, significantly higher when using post-cyclophosphamide. So this is a very important study in my opinion because it raises awareness about the fact that definitely post-cyclophosphamide is a valid option for GvHD prophylaxis, including in the sibling donors, HLA-identical sibling donors. However, we need to be aware about the increased risk of extensive chronic GvHD when you compare it to ATG. So in my opinion, for the next few years or so, ATG as a GvHD prophylaxis remains a very powerful tool to control this deleterious complication of chronic GvHD, which can clearly impact the quality of life of the patients.